Welcome to one more edition of Politics Done Right. Today, I am once again with Dr. Anand Bhat. He's one of the young doctors, progressive doctors out there that is really getting the work done. I have a few questions for him. And, today he said, Egberto, you didn't tell me exactly why you wanted me here. And I said, I did that on purpose. But anyhow, Senor Bhat or Dr. Bhat,
Yes.
first of all, how are you doing?
I'm fine. I'm here in Louisiana, and I have nothing to do right now.
Well, look, have you been?
Politics.
Have you? I understand that Louisiana is not as bad as it was a few months ago when the COVID infection rate was very, very high out there, one of the highest in the world, actually.
hmm they had several waves, I think, because they were part of the initial wave
Right.
when Mardi Gras hit, and so New York and New Orleans were very high. Now, then they had like a second wave. Now maybe a third wave. It never really like slowed down. The issue I'm noticing is our governor has a mask mandate, but when I'm outside of Shreveport, I don't notice people wearing them. They're pretty good, consistent users where I live, but when I visit my wife in Mississippi and I stop in the towns on the way, I don't see people using it. So also another thing is I'm actually more scared of the non-clinical staff than I am of the physicians and nurses, because I think they will do the right thing. But a lot of, non-healthcare workers go to weddings without masks. Everybody has to get masks. I'm back in the South. There's always a wedding. You got to have 100 people at your wedding. Got to not wear a mask at your wedding. It's just like, so I'm more concerned about the community and the non-health workers in my situation than I am with the actual like doctors and nurses.
It is interesting, Anand, because my daughter, who is a med student in DC, she's here for Christmas. She did all the right things, put in all, she came here with the right gear on the airplane, everything, and covered up tight. And she went out for a walk yesterday with her mother, and she rushed back and said, I can't do this. Nobody here follows any kind of protocol. We're here in Texas. And she just ran back to the house and says, in DC, everybody's covered up. She said they're taking it seriously. Here,
My uncle
everybody's
visited Houston from Massachusetts for a month, and he said nobody's following the rules in Texas compared to Massachusetts.
Right. And, I think that the stats are actually bearing that out. Now, let me ask, the reason I wanted to just get your statement as far as how you felt this pandemic was going from the perspective of the medical system. How do you think the pandemic is? Where are we in it?
I think it's worse than ever. I think it's everywhere now. I think there was a perception at the beginning that it was a blue state urban immigrant sort of thing, because when it started out, it was sort of New York, Detroit, New Orleans, and wasn't happening in the rural areas. And now if you look at the numbers, last I checked, per capita, North and South Dakota were the worst in the country. Basically, north of Kansas, Iowa is bad. Wisconsin is bad. My old job in Ohio, when I worked in May or June in the COVID unit, we had maybe a dozen to 20 people in the COVID unit. I text back my colleagues back there, there's like 70 now.
So, as in 7-0?
7-0,
versus 1-1.
Yeah, 7-0. Like a dozen to 20 has now become like 60 to 70.
Wow.
So again, even within Ohio, it started out in Cleveland area first, the big immigrant, more cosmopolitan city, people who had travel, but now it's generalized everywhere. So the thing that people don't understand is that healthcare is concentrated in the cities, and you're in rural areas, you get worse care. And there's no doubt about it. And everywhere I've worked, and I've worked in now 5 states now. If you're in these rural areas, you don't want to wear a mask. Well, there's not many beds at the hospital near you. I'm sorry to say, you're better off getting sick in a bigger city in general before the pandemic than you would now with the pandemic. The cities are full and there's no capacity in the rural areas. Where are they going to send you now? So people.
Right. So what you're seeing then, Anand, is that based on what you're seeing, the rural areas are getting hit very hard. You said that. I think you're in Shreveport or no?
Yeah, I'm in Shreveport.
You're in
but
Shreveport.
I think rural areas everywhere are getting hit. I mean, they're getting it. They don't understand that rural people, well, let's just talk about healthcare, need the cities. When you don't have what's available locally, you have to transfer them to the closest city. And in where I live in North Louisiana, I'm in the big city, which is not that big, but we have the medical school, so that's the big
Right,
city.
Shreveport, yeah.
So yeah, that's the main medical city in the north of Louisiana. So if Shreveport is full with people with COVID locally, they can't start taking in people from elsewhere. And there's small, medium, large. We're the large in this area. The medium cities might start getting filled up, and then they might be taking transfers. Even mid-tier cities, like where I was working in Ohio, was like a mid-tier city. We were basically accepting the patients from what I call like bandage stations.
Hmm.
You know, the hospitals, 20 miles out from where I was, 20, 30 miles out for them, they basically don't offer much of anything. And we were the receiving. So I think we were like a second level, second tier hospital. And then if we got something very bad, we would send it to Cleveland or Dayton or Columbus. That's how these things work. And when it comes to ICU capacity, you don't want to be in an ICU in a rural area. They may not even have an ICU.
It's interesting because with all of this that is occurring, the people that most have a concern or most rebel against wearing masks are the people who, when they get sick, will have the least support from their system, from the given again, these are a lot of rural areas, etc. And these people, they don't believe it's real. Now, how real is COVID-19? Isn't COVID-19 just the flu? Isn't COVID-19 just going to give you a little bit of a cold with a few body aches and then call it a day? Is that what it is, Sanan?
No, this is not a flu. I mean, the flu exists, it happens. And I don't know with this new strain in England, I don't know how deadly to call it now, but a flu does kill people and we don't take it seriously enough. This is much worse than that. This leads to long-term side effects, mental, physiological, a lot of like disability, like people having trouble walking afterwards. Yeah, it's mostly older people, but just because you get it and you survive doesn't mean the rest of your body is okay. It's not a respiratory disease only. Very early, I remember.
Let me stop you because I think it's important for you to stress that when people talk about the flu, it's mostly a respiratory disease, mostly.
Yes.
But when it comes to COVID has proven to be systemic, correct?
Yes. Yeah. That's why it stands for SARS, severe acute respiratory syndrome. But it is a multi-systemic inflammatory disease. That's why they have blood clots. There are people dying of COVID not from respiratory disease. I think a friend, not really a friend, but one of my classmates from Beaumont, his dad died. And I want to say it wasn't from the lung, it was from the clots he got from the COVID.
Right.
So, and then we have no idea what the long-term sequelae are. I mean, well, people in the general public also doesn't know. And again, I didn't know it till I was in residency. There's something called post-ICU syndrome. There is something called PTSD from being in ICU. This is before COVID. If you were in ICU, you get ICU delirium. You can get PTSD from being intubated, sedated, people poking and drawing blood off of you all the time. And people do have long-term effects. Just being in an ICU, forget about COVID. Just being in an ICU is dangerous for your mental and physical health long term. So that's not a joke either.
That is sad. Okay, let's go now to where to kind of branch off because I am a Medicare for all. I don't want to call it a preacher. I don't want to call it a fanatic, but supporter because I believe it's the only solution to our medical problem. Now, given the amount of systemic problems that we can have with COVID, isn't this one of the diseases that should us make it much easier to support the Medicare for all policies?
Yes. Yes, it should be, but it's not.
But my next question then is, what must we do? You are deep in with organizations that are in fact pushing for Medicare for all, among other things. What can we do going forward to show that, given that this thing is systemic, given that there are a lot of 20-something-year-olds and 30-something-year-olds that likely will have organ damage that won't show up until 10 years down the road, And likely, if we don't have the right policies, insurance companies are going to dump you and say that's a pre-existing condition. How do we sell that to the masses right now?
There's a that's a tough one. And I will answer with a novel, which you
Well,
hate
you give
novels.
speeches a lot. You talk a whole lot to organizations.
I do, I
What do
do.
you tell them to do?
Well, I haven't told anyone on this topic lately, but there was you talk about your daughter, you talk about the youth, you talk about, I'm trying to get involved with Doctors for Burning, which has now become the Health Workers Collective with the DSA now. And I have to proceed, because now the people, I'm not as a spring chicken anymore, I suppose, but I'm trying to get people, what do they want to do? They want to know from people like us what they should do. Well, I'll answer. There's a very famous novel, perhaps your daughter has heard of it, called The House of God, and it's from like 1970s.
Mhm.
Famous novel about residency in the 1970s in internal medicine at Harvard, but he doesn't call it Harvard. He calls it man's best medical school, BMS, and man's, instead of Massachusetts General Hospital, he calls it man's greatest hospital, MGH. So it's a story about how terrible and inhumane the medical system was at that time. Of course, now you and I would look back at maybe that was the better days,
Right.
in terms of, a lot of the political issues, some of those things were a lot better. Well, he wrote a sequel last year called Man's Fourth Best Hospital. And in the sequel, he talks about the main characters going back to that hospital and how they have new troubles that they never imagined. It was no longer the doctors were not humanistic. They weren't caring about the patient. They weren't using hospice. There was all these things. There was obviously sexism, and at the time it was the Vietnam War, so he was always upset about Nixon. It's like Nixon is the least of our problems now. And he talks about the medical billing system and how it just makes money and how it's related to big finance, because the tech companies create EMRs, which are so expensive, they're even bankrupting very rich hospital systems, including in Houston. MD Anderson, I think, has issues with their billing system. And he is saying, again, I haven't looked at the numbers, but I did see an Epic rollout in one of the hospitals I worked at. They charge a lot of money, and not just to install the software, to maintain the software. They charge big money. It puts hospitals in debt, and then the hospitals have to respond. Any debt you have to has to be paid back, and you pay it back by oppressing the doctors and nurses further. There's just no other way to make
So
it
you're saying the billing system that these hospitals use come from the outside, and that these people on the outside are attempting that a lot of the billing that the hospital have to do is to recover costs from just a billing system,
Yes,
something
yes.
that does nothing other than collect a bill, almost like an
No, no, no,
insurance.
no. It does more than that. Well, that's the problem. It is supposed to be for documentation
Right,
and billing. So the problem with an American EMR is that it's all designed for billing. It's not designed for medical care. That's why
right.
the VA and the Indian Health Services, which used to have their own EMR, but Jared Kushner recently canceled them. They had their own EMR. It's designed totally differently, and it was designed to provide clinical care. Our EMRs are designed to comply with government regulations probably subsidized by legislators, subsidized by one of these two companies. Both of them are in the Midwest. Epic is in Wisconsin, big supporter of the Democrats. And there is another one in Kansas City, which is Cerner. And these are mega companies. And I lived in Kansas City briefly, and they are sprouting offices left and right. And these two companies represent a huge percentage of the market. And if you don't want to use them, you have to use really suboptimal technology.
Like
And
paper.
yeah, well, no, well, there's a few third companies around there, but they're terrible. I mean, they're terrible. The options besides those two is just like, it's like everything in America. Everything is a duopoly. You go to Walmart or Target, you go to
Mhm.
Home Depot or you go to Lowe's, you get Coca-Cola or you get Pepsi. Like there's never a third
Always two
choice.
majors, and everybody else
Yeah.
are the fringe.
Yeah,
Yeah.
you go to CVS or Walgreens. That's it. There's never a third choice. And so and I can guess that this is based on a lot of research. What he was saying. Anyway, to get into what happens, he in the story, I'll sort of end the book. Basically, the experiment to have a humanistic healthcare practice that pays and both is good for the doctors and nurses, because doctors have a lot of burnout, especially in primary care medicine. the hero of the story kind of has this humane medical practice that does very well, but then something happens, and at the end of the day, the whole system collapses. But a medical student on the rotation with them, he says, "Well, you know what we're going to do is we're going to set a date of 2025, and all the doctors, all the nurses, all the janitors, all the people who work in healthcare, the people who do the work for a living, not the administrators who may have MD or RN behind their names, but everyone who does work for the healthcare system, we will go on strike until we have Medicare for all." And announce it 5 years in advance. This is the actual ending of this novel. This is a very famous novel, and this is the sequel. And the not the oldies, but the new generation, she goes, and after she's disappointed with what happens, she raises a bunch of people, radicalizes them, and they all say that we will determine the healthcare system. Those who work will determine where we work, and we will determine what happens, not administrators, not other people. And they go on strike at the end in the epilogue, and they win, and everything becomes humane. And the book actually starts in Costa Rica, where healthcare
Where
is
you have socialized medicine. Yes.
yeah, right.
Yes.
Which is known to actually be, for a developing country, one of the best healthcare systems in the world.
It
But
sure is.
the commitment to health is a political commitment. The political system of Costa Rica and certain other countries, very poor countries, or even a few states in India, Kerala, Tamil Nadu recently is another one that they mentioned. There has to be a strong political commitment to health. We don't have that in our political system.
That's what we have to make, though, Anand. That is what we have to make. And I think this is where grassroots is so important. I think we have to get the grassroots involved more so than ever, because that is what's going to take against all these big forces. You know, I have this statement that I call insurance companies are nothing more than choosing which plantation you want to work on. I notice I didn't say work for.
Say the two parties, you know.
Yeah, exactly. You're right. You're absolutely right.
And that's the thing I've been trying to explain to people, because, you know, in Texas, I had a certain view of politics. Then I lived up north for 8 years, and I came back, and I have to say, like, the coalitions that have to be made are going to need to be of low income people.
Yes.
Or people who work for a living have to make these coalitions.
Right.
Because as long as you have two types of poor people in two different parties, nothing is going to work. It's not going to work.
Magic. And you know what? That is the reason I take the stance that I take. That is the reason I even wrote this book, How to Talk to Your Right-Wing Families, etc. Because we have to get them all involved to get this Medicare for all going.
Well, why is Louisiana, at least in terms of healthcare access, better than Texas? Because of Huey Long.
Right.
Texas never had a Huey Long. And Huey Long, if you don't know, a lot of people of both races are named after him, including the Black Panther.
Yes.
Huey Newton is named after Huey Long. And Huey Long, even though, yes, there was racism, there was segregation, all of that is true. He did more for the health of all poor people in Louisiana, because before he was governor, there was no LSU medical school. There was only Tulane. And he specifically built a state healthcare system, which Texas doesn't have. The state government has multiple hospitals throughout the state, and the medical school, LSU, and then the LSU eventually in Shreveport, would train a new generation to do research, treat patients, and do research, and deliver. All three things have to happen. What we're having is our top places, they might just do the research. They're not delivering to the rural areas. They're not out there to help the other people. And I think the ideal, if from what I understand, I mean, I'm new here in Louisiana, I think the original idea was to have a state healthcare system with a state university attached to that, and deliver that healthcare to the poor people. Because in Louisiana, honestly, everyone is poor. Rural or urban, everybody is poor. And the problem with Texas is there's just enough rich people to make them think they can all be rich. And there's not enough rural people. And there was never a Huey Long. That's the problem with Texas. And the cowboy culture. The cowboy thing, I think, is another problem with the Texas culture.
Well,
why is healthcare access so much better just across the river? I mean, Louisiana is backwards in many, many, many other
right.
Don't even get me wrong. But why is healthcare access better in Louisiana than Texas?
That's the magic. And I'm glad you said that. And, you know, you were talking earlier when we started the conversation, Egberto, exactly what are we going to talk about? You hit the magic plug. We are going to have to get all people, not through a duopoly of poor people, but all people in both parties and all parties together on the bottom that's going to demand this. We are out of time, Anand. That's the magic answer of the day. Thank you so kindly for having been here on Politics Done Right. As usual, you young man always have a word of wisdom. Thank you so kindly for being here, brother.
Great to be here.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.